Hello and welcome back to my channel. My name is Dr. Shanai, and today I'll be discussing about a common topic called as HbA1c. So a lot of diabetic patients already know about this, but the thing is they have some doubts about that, which I'll be clearing. And for those who have not heard about this test, so this is the basic information what I want to give. HbA1c, as the name says, it is hemoglobin A1C test. Hemoglobin A1C test. You see, there are four basic components of blood. So blood has got basic components. Those are four components. One is plasma. Plasma is like a water. It's a watery substance which is running through the blood vessels, carrying the other components as well as nutrition to various cells and various parts of the body, in the various parts of the body, the tissues and all that. Secondly, the blood contains what is called as red blood corpuscles, red blood cells or red blood corpuscles, also called as erythrocytes. Erythrocytes. So RBCs again has hemoglobin in it, and the blood also contains what is called as leukocytes or white blood cells. Leukocytes. Leuko means white. Okay. Leukocytes or white blood corpuscles or white blood cells, or also called as popularly called as WBC. WBC. And fourthly, the blood contains what is called as the platelets. The platelets are the sticky substances which help in clotting of the blood. Clotting of the blood. See, whenever there is a bleeding, the platelets come to the rescue along with there are many clotting factors. I'll explain that in some of the future videos, but platelets is one of the main components, which is a sticky substance which sticks to the lining of the blood inside the blood vessels and tries to seal the blood, the leakage. That is, so the hemorrhage is stopped. That's how the platelets work. So this red blood corpuscles, that is the RBCs, contain hemoglobin, and hemoglobin has got the glucose attached to it. Hemoglobin has got glucose attached to it. Hemoglobin is responsible for the red color of the blood, okay, and also the red color of the RBCs, to tell in the plain language. Okay. So lesser the hemoglobin value, the patient becomes anemic. More the hemoglobin value is also bad. So it's usually around 11 to 14% in the males, and females a little more. Okay, so this is hemoglobin. So females require a bit of more hemoglobin to stay away from anemia. Naturally, it's more. Minimum for males is 11. A little more is better, but minimum most is the 11 to 12. Okay, so that I'll discuss later in some other video. But in my today's topic, I was saying something about HbA1c, hemoglobin A1c. So this test, what they do is they determine how much glucose is attached to the hemoglobins, and in the last 3 months, whether you had diabetes or not, whether you are a diabetic in the last 3 months, or you were a pre-diabetic, means previous to diabetes there is a condition called pre-diabetes, where the blood glucose is little more, but the patient is not yet diabetic. So it gives a rough idea, or whether you are fine. Okay. So what the lab technician does is, you go to the medical lab and give the blood. He draws the blood from the arm, and he suggests some chemicals are added, and they do the test. That details I will not go into. So they get the results, and this is told in terms of what is called as mmol per liter. Mmol means millimoles per liter. This is a kind of a measuring word, unit, what they have medically. mmol or millimoles per liter. Okay. It can be converted into milligrams in deciliter also, the common, but usually HbA1c is told in terms of millimoles. So if you find a result of about 5.7 millimoles mmol per liter, up to 5.7 is fine, normal. Okay, here there is nothing about the fasting after food or whatever. You can go at any time to the lab. You can go at any time to the lab once in 3 months. That is enough. Anytime after food, before food, because it measures, it gives an idea of last 3 months what is happening. Okay, all right. So millimoles, 5.7 and 5.8 to 6.4. They say it's pre-diabetics. The person may be pre-diabetic, means he has got a tendency to develop diabetes. He should be careful about his diet, and sometimes the doctor may prescribe very mild medicines to keep the blood glucose or blood sugar in check. All right. So more than 6.4, the person is called as diabetic. The doctor says, yes, you have diabetes, you should have the treatment. And what kind of diabetes, the doctor will determine whether it's a type 2 or type 1 or whatever. Okay, usually this is done for type 2 diabetics. All right, means where the insulin utilization is not good. Okay, type 2 diabetics. So remember these values: up to 5.7 mmol, it's normal. 5.8 to 6.4, it is pre-diabetes, and more than 6.4, it is diabetes. It is diabetes. This is what the doctors say. See, some doctors tend to disagree with this kind of a test. They say this test is not at all good. It's not reliable at all. Mainly the reason what they give is, sometimes the results may vary. Throughout the day, if you give the blood 2 or 3 times, the 3 results may vary. Okay, it may not be the same. Number 1. Number 2 is in the anemic patients, this is not at all reliable. In anemic patients, what happens is hemoglobin level comes down. So this may not be a reliable test for the anemics. And thirdly, the kind of the variations in hemoglobin level in the last 3 months, it may give a false result. So this is what they say. Because this is mainly measured by the glucose attached to the hemoglobins. That's why it's called as HbA1c, hemoglobin A1c. So this is what the objection many doctors have and many health experts. But some doctors say this is the best test, and they order their patients to undergo this particular test at least once in 3, for diabetes once in 3 months, for others at least once in 6 months or a year. They request the patients to get it done. For the diabetes, once in 3 months. Usually it's once you get it done, no need to go back to the lab and get it done again before 3 months. After 3 months, you can go and get it done. If consistently you're getting a good result, don't worry, you're healthy. Okay, as far as the blood glucose goes. So this is all about the HbA1c test, which is a very simple test, a bit expensive, a bit more expensive than the regular test, but once in 3 months, right? So that is it. So it gives a rough idea about whether you were a diabetic or pre-diabetic in the last 3 months at any point of the time. If any point of the time, it gives the highest result. At any point of the time you had because they say the blood glucose attached, the glucose attached to the hemoglobin, it doesn't vary for the 3 months. So that's why the results is reliable. That's what the believers say. Anyway, it's up to you, and it's up to your doctor. If your doctor is advised, you can get it done. Okay, so we'll meet in the next video. I given a bit of information about HbA1c. So we'll meet if you have any doubts, please put it in the comment box, and I'll be glad to answer you. So take care. I'll meet you in my next video. Till then, take care and stay healthy. Bye.